Over the last few months, we have had to reassess the way we run some of our services to make them as safe and accessible as possible. If you have a heart condition, cardiac rehab is a vital part of your care and management, so here are some of the ways that we're providing you with the services you need in the safest environment. If you've had a recent cardiac event, it's likely you'll be referred to us. Once your referral has been received, a clinician will review your notes and if needed will phone you in the first few days of discharge to discuss your hospital stay and recovery. In the first 2 to 3 weeks of discharge, depending on your condition, you'll be invited to attend an appointment with a rehab clinician. At present, we are making use of telephone and video consultations, which provide the perfect opportunity for you to ask questions or discuss any concerns with an appropriately qualified clinician. We will assess your symptoms, lifestyle, recovery and discuss medications. This means you can receive your clinic in the comfort of your own home. After this assessment, it's likely to be appropriate for you to take part in a programme of education and exercise to learn how to manage your condition, improve your heart health and reduce your risk of problems in the future. We have produced a wide range of exercise videos tailored to your condition and ability. Appropriate exercise levels will be discussed in your clinic and you'll be directed to a series of exercises that you can safely progress through. With the help of regular follow-up calls from your clinician, you'll be guided to achieve your goals. We have also produced a range of informative 15-minute podcasts with various experts such as cardiologists, specialist nurses and therapists. These are freely available on our YouTube and Facebook pages and you can listen and watch as many times as you wish. You may also be invited to join Recap Health, an online patient platform where we can choose and share with you specific information for your condition and needs. You may opt to attend our face-to-face exercise sessions where a one-way system will allow safe distancing and hand sanitisers will be readily available for you to use on entering and exiting the building. All patients attending will answer health screening questions and have their temperature checked remotely before entering the class. If we need to come into closer contact with you, for certain tests for instance, we will always wear appropriate personal protective equipment. So you may see us wearing face masks, head visors, aprons and gloves to keep both you and ourselves safe. During the session you will have your own space in the class and this will always be more than a 2-metre distance from other patients. You may be asked to wear a fitness tracker during the session to help monitor your exercise response and guide exercise intensity. You must bring your own refreshments with you as water stations will not be available. Before and at the end of the session, all chairs, equipment and contact points will be thoroughly cleaned using the same disinfectants and detergents we use in our hospital. So during these uncertain times, we want you to feel safe and comfortable, and most of all, we want you to enjoy completing your rehab programme with us.